Hello everyone and a very warm welcome to all of you into my channel A to Z Therapy with Smruti. This is your host Smruti Mishra. I am an occupational therapy and clinical psychology student. So come, join me on my journey of becoming a therapist and let's learn together.
Hello, everyone, and a very warm welcome to our official podcast. Today, we have with us is Mr. Anand Subramanian, who is a registered physiotherapist from Canada, and we have with us is Dr. Hara Prasad Mishra. Today, as you guys know, we have already done some podcast with Mr. Anand. He's a physiotherapist from in Canada and is currently practicing his physiotherapy in multiple settings in Canada. Primarily, his study background has been in India, and he has some 20 plus years of experience in the field of physiotherapy, which is quite rich. And we are so honored and thank you, sir, for accepting the invitation.
Yes, Smriti. Thank you so much. Thank you, Dr. Hara.
Yeah,
definitely.
So today our topic is basically on pain relief and nutrition. So my first question to you, sir, Anand sir, is how can therapy be a part of pain relief program, whether it be occupational or whether it be the physicals or whether it be Reiki therapy? There are so many kinds of therapy. So how can therapy be a part of relief programs?
Absolutely, yeah. Because therapy play a major role, especially physiotherapy. As a therapy point of view, I can talk about it because main thing everybody suffering with some or other different type of pains, right? So main thing is we'll go for the medical attention, surgical intervention, and when coming to the physiotherapy point of view, we will deal with the musculoskeletal and also the neuromuscular conditions, right? Because everybody having some symptoms when they ask they have the pain, we give the scale of 0 to 10, how much is the pain scale and everything. So after that, we have some solution to offer to the people. So we thankful enough to learn about the, pain pathways and lot of things we are going to cover upon. So the main thing is that is really beneficial for all the people. Yeah.
Okay. So how do you think that physical therapy, primarily physical therapy, can play a role in pain relief?
Absolutely. Maybe before going further, I may share the screen so
Yeah,
that,
sure.
I can explain you through that pain pathway. Can you please give me an access
Oh,
in
yeah,
the
one
screen?
second.
Yeah.
Just a second.
So there are two receptors in our body. Main thing is, enkephalin and endorphin. These are the receptors are very, very responsible for our, pain relief. Right? So the continuation of this
Yes, sir.
discussion, Smriti question about, how the pain pathway and everything, right? So what is the role of physiotherapy? So before going there, just giving a simple, glimpse of what is the pain pathways to get an idea for everybody to know, right? So this is the things I want to share few on one slide. Here is a slide I want to highlight about is that the pain pathways. This is the way. Nociceptor means when there is something is hit in our body. Sometime when we fell down, we get a fracture or something, the mosquito bite, small pain to the larger pain. Automatically we'll get the pain. What happens is when the pain happen in our body, it will transmit it throughout our the fibers, and then it will go to that, the spinal cord. Then it will be the stimulus will be recorded and then it go to the brain. Brain will tell that okay, there is something, the pain is happening in particular area. If it is a normal pain, when we scratch and everything, it will be gone away. But if the pain is consistent, then we need to take care of it. These are the two receptors in our body. It's responsible for the pain mechanism. Naturally in our body that secretes such receptors, enkephalin and endorphin. But what happens is when the pain is severe, the pain or the receptor cannot be able to produce too much of relief. So at that point, what we are going to do is actual. I'm stop the screen. And main thing is that we are using our modalities, especially as a physiotherapist. We place that electrodes over the particular pain area, so that stimulus will go to that spinal cord, and it initiate the receptors to activate more, so that when the receptors function more, it will go to the pain area. The pain will get subside. This is just a glimpse of the idea, right? So the physiotherapy, there are different modalities. By the way, we have electrotherapy, exercise therapy, a lot of different modalities we'll use. Now recently we are using the laser technologies, right? And A lot of manual therapy techniques are, nowadays booming nowadays, big time. People are looking for the hands-on techniques. We are going to touch upon later on. That's
Mm-hmm.
what answer for you.
Yeah.
You can.
I will be adding some brief layouts for the audiences. Anand sir explained it in a very deep understanding manner. To be shortcut, see, the pain pathway can be depending upon what pain we are talking about and at what level. The pain can be perceived at the spinal level, at the level of the brain, and also at the local level. For example, an ant bites your cheek, you say, or some kind of finger. So that kind of pain is perceived in a different manner compared to a sharp object getting pierced. For example, someone stabbing. So that is also pain. And simultaneously, there can be a neuropathic pain. For example, the pain associated with various neuropathies. And also there can be pain of a MI, the myocardial infarction. So all these are kind of pain, but they have a different logic behind them. For the interest of the audiences, and to make it more simpler, we can just say that, for example, we are having a channel, and for the same channel we can have multiple routes happening. It can be, for example, today you are seeing a news, and the news can be from your local region, it can be from your country itself, and it can be also from the international market.
Mm-hmm.
So the same way the pain is like that, it is perceived at the same place, but the routes and the channel which are used can be different. Yeah, Anand sir, you explained it in a very well manner. I will want to highlight that functional manual therapy is also a great booming field, especially for pain relief sector. So can you brief more about it in a detailed
Absolutely.
manner? Yeah.
Yeah, absolutely. Because when we studied about the physiotherapy, we study a lot about the manual therapy techniques. Especially there are different manual techniques available, especially McKenzie techniques, Maitland, Mulligan, Carlton Bone, like that. There are a lot of techniques we learn. We'll use the techniques depends upon the people need level, especially soft tissue release techniques. Myofascial release techniques. These are amazing. For example, what happened is the manual therapy is amazing. We can give the immediate relief when the patient is looking for
Yeah.
something. And nowadays, if you see, everybody's looking for something like hands-on techniques,
Mm-hmm.
right? So
Definitely.
especially in sports people, for example, in the sports arena, if I as a physiotherapist, I can give the relieve the pain with some spray and everything. But if I do the small techniques, at the particular point, to relieve the trigger points, automatically the player can be able to involve in the sports, right? The
Yeah.
same way
Yeah.
for all the people
Yeah.
also. Yes,
Mm-hmm.
yes, it's amazing.
Yeah.
Everybody has
Uh,
to learn.
yeah, definitely. So pain relief is something which is spontaneous, and the patients also look for spontaneous results. They don't want a long-term solution. First, they want is a symptomatic solution,
Mm-hmm.
Mm.
and that's why I will say the pain relief pharmacy agencies, the pharmaceutical drugs which are dealing with pain, the be it the painkiller or be it various steroid injections or various kind of drug therapies which is available in the market, and also herbal therapies are coming up. So I will say that it's a booming field, and in the times to come, a lot of training is going to happen, and we all are going to see a new change happening. Yeah.
Absolutely. My next questions are what are the basically traditional? There are always, traditional and conventional, unconventional methods. So, what are the traditional and unconventional therapies of pain relief?
Absolutely. I can touch upon that because I'm coming from South India,
Mm-hmm.
so we are more into traditional background of
Yeah.
until today practice going on, right?
Hmm.
Yeah,
Siddha,
alternative medicine.
absolutely, absolutely.
Yeah.
Homeopathy, Ayurvedic, Siddha, and also natural way of treatments. A lot of things are booming nowadays. Even we are following now the ancient methods we are making as a trend right now. Even
Yeah.
especially in North America, even for yogas and whatever, people are implementing new things. They're thinking that it's a new one. But if you take a traditional background, it's amazing. They use all the methods. Simple example, if we take our grandparents, they never go to the doctor or hospital. That time, no facilities at all. They treat themselves, right? Because they have the traditional way of approach. But now we have the advanced method. It's really we have to thankful for that. We have the opportunities to cure the problem with the advanced methods nowadays, right? Yeah, absolutely. Yes.
So yeah, so I will be interested in adding some points. One is that what I see is that in future, medicine will not be having a fragmented approach. Rather, it will be having an integrated approach, in
Hmm.
which for a special element, we will be having multiple physicians working upon to cure the patient. For example, I will take an example of say frozen shoulder, which is a very common in Indian subcontinent. I don't know
Yeah.
what is the status in Canada. Anand sir can tell more about it. So there is a patient of frozen shoulder coming up, we can first of all try physiotherapy. In addition to that, we can also use some kind of painkillers which are a part of allopathy for immediate relief.
Yeah.
Simultaneously, we can work upon various yoga asanas to build upon the strength of the muscles. Simultaneously, naturopathy can be tried and Ayurveda can be tried for herbal products. And in this way, the muscle, you can say, rejuvenation can be happening. Also, in the coming days, stem cell is going to be booming industry. So stem cell is you can
Yeah.
say, a child of modern medicine. So
Hmm.
in this way, we are having an integrated approach rather than a fragmented approach. And what I will say is that this is like a wheel, and we don't need to focus upon a single spoke rather than the whole circumference. And in this way, what will happen is that the center will be having the maximum benefit. So it's a
Yeah.
wheel concept, and it's the future. And I hope integrative medicine is coming up, and I'm also practicing that kind of, yeah, and I'm also collaborating with stuff, and I hope Anand sir is doing that as well.
Absolutely,
What's your
absolutely.
take, sir?
Yeah,
Yeah.
really, really wonderful explanation, Dr. Hara. I really learned from you. The thing is, it's like a wheel. We are
Yeah.
coming to the center point. Center point
Yeah.
is the person with the pain, right?
Hmm.
So we need
Yeah.
to go with a multi-integrated approach or multidisciplinary approach.
Yeah,
You know,
definitely. Hmm.
yeah. Main thing is the awareness to the people is, we need to be open to learn from the everyone, because every facilities, every field has its own effects. So
Yeah.
we need to openly explore that and then find out whichever suits for them, because
Hmm.
somebody may work with something, so we have to go according to that. We cannot
Yeah.
close our mind that okay, I'll go only with one therapy, I don't go about other things. That will not work out. At the end of the day,
Yeah.
cure is matters, right?
Yeah.
Yeah. It's simple kind of stuff. Yeah, I will say it's to be very simple and precise for the audiences. See, our ancestors or even our parents who are in their 50s, they prefer pure Indian food, and we
Yeah.
as a generation prefer a kind of cuisine which is Indian, and some part of South Indian dish as well, some part of Italian, and all that. Also, pizza is coming up, and we are also digesting it as well as we are enjoying it. But yes, that's the platter, and that what happens when we have a plate with multiple cuisines, and that also satisfies your taste buds and also satisfies your need of various calories and nutrients. In the same way, I hope that integrative medicine will be pursued, and in the down the line 10 years, I believe that the industry is going to be integrated. Yeah, Smriti.
Absolutely.
Yeah. So we talked about, yeah. So, both of you have beautifully explained the importance and need of integrative medicine and integrative practice. What do you think that, as Dr. Hara even asked about, that naturopathy and Siddha and all. So, how do you think diet plan is like? What kind of diet plan is the best, or along with therapy, what all diet can be, include for pain relief and all?
As I learned from many of the things from my wife. She's a nutrition consultant.
Hmm.
If I have, she always talks about, nutrition play a major role, especially the diet plan,
Yeah.
because I'm not the expert in that area, because that nutritionist, they don't know in depth of it, what type
Hmm.
of diet for the different type of people, for
Hmm.
diabetic people, how to give, for cardiac patients, what to give. But I can touch upon general information which I gather from my wife.
Hmm.
Now, what she tells us, the diet play a major role. Even though whatever the medication or anything therapy you are taking, that everything we are taking, internally we are taking some medication, but coming to the physiotherapy, we are treating everything on the external, outside, right?
Hmm.
But we need to balance our body with the inside feeding. Whatever your input only comes to output, right? So the nutritional diet, what when we take, for example, I can connect with a new physiotherapy with the nutrition. If the person is suffering with a joint issue, the person, if you take along with the therapy, if they take something supplements related to the joint health, like a glucosamine, HCl
Yeah.
combination, some of the supplements will really work on inside their cartilage and their bone and the joints and the muscles. For muscles, we can recommend about the protein. So protein rich diet. We always tell, even though physiotherapists, when we come, once we finish our therapy, we tell them eat healthy food, eat a good soup. Even today, our day-to-day practice, I let them know. Even one of the sheet we have is we supposed to tell couple of the recommendation of supplementation. It is a day-to-day adding. We need to do it, right?
Yeah.
Hmm.
Absolutely. Yes.
So yeah, it was a great case study by you, Anansa. So I will just add upon two things. People don't understand the value of the basics.
Yeah.
They look for hi-fi things. I will just keep it very simple. For example, a medication works in acidic pH. Even the layman can understand what is an acid. So if a medication works in an acidic condition and your diet is having something which increases the pH, that is towards the basic level, so the medication is not going to function.
Yeah.
So what's the reality is happening is that you just should keep in mind that everything adds upon and everything counts. So that's why diet, even your sleep pattern, even I will say your genetics and also your environment is going to play an important role in the coming days, because nowadays the pollution levels, the kind of stress we are having is altogether different. 100 years back it was not a factor to count upon. 100 years back it was only drugs, therapies and stuff like that. But nowadays the pollution levels, the environment we are living, and the kind of stress level we are going through, these
The
are also adding
lifestyle,
up. So
basically.
yeah, so basically these things need to be kept upon in mind, and that's why diet is going to play an important role, and that's why the dietitians.
Yeah,
Absolutely.
absolutely. Uh, well, the COVID pandemic showed us, the importance of we all were working from home, and students were doing their classes, working people were taking their meetings and all everything. So, the screen time has increased maybe exponentially for every individual. So, how do you think the posture is being like we all know posture is being compromised, right? So, how do you think that we can like despite of increase in screen time we can take care of our postures and not let neural issues you know uh, affect our body later on. So how do you think we
Absolutely.
can? Yeah,
Yes, Smriti, because that's a good point right now. People are, everybody's into mobile, everybody's the gadgets, right? New
exactly.
phones, smartphones, because we all have time, more time now, to spend the time watch YouTube or, film. A lot of things we are going through all the channels, Twitter, Instagram, LinkedIn, everybody's in the phone somehow or other. Even if we say, everything is, computer based right now, for example, job, everybody's working
Exactly.
from home,
Yeah.
right? Students all studying from home. Actually, our daughter is right now in 8th grade. So, she's from last September. She's from home, being home. She's studying everything online classes.
Hmm.
We purposely didn't send her to the school because of the pandemic. Even still, right now, it's a lockdown. When you're talking, it's still going on in Canada right now,
Yeah. Yeah.
right? So it is not safe. But the thing is, the posture wise, every time I'm telling her, you are sitting not good position, you have to change. Even I sent one of the screenshot to her recently, that for the benefit of everybody, I'm going to share the same, which one I shared to with my daughter actually recently. Okay. So it's really a awareness, when you see this screen, you will know the why we need to really take care. It's very, very important. Just I'm going to touch upon that.
Okay.
Now, this is a nice picture. I got it from somewhere. So when I was in LinkedIn, I think somebody posted it. So the main thing point I want to share here is you need to get the point here. See, when you are come to the lower level of the picture, you can see when you are doing more workout in the computer, when you see the position like this, see the posture here.
Mm-hmm.
If you look in here, instead of keeping like this, we are keeping like this. When you bend down, what happens is the more pressure going on your spine here, especially in the cervical spine, the neck. So what happens is when there is a pressure is happening more on here, there is a disc in between the two vertebrae, okay, and
Mm-hmm.
then the nerves are coming on the side. If you go and take the anatomy of the structure, what happens is when the bone coming close to each other, if you see my screen, it will compress the disc. Automatically, the disc get bulge and it go and compress the nerves which is passing on the side. So one nerve supplied to the right side, one nerve supplied to the left side. What happens is because of that, people get the called brachial neuralgia. That means in a layman terminology, what I can tell is it's a numbness. People complain
Mm-hmm.
of soreness throughout the arm, and also the pain, stiffness, okay, heaviness of the arms because of prolonged usage, right? So because of that, what happened is here that the pain happening in the neck as well as the head as well as the finger, elbow, the posture, when you're sitting the position, everything will be altered. Because of that, we are getting pain in the joints, in the muscles, the spine, in fingers. A lot of neurological issues are happening here. Okay. So what is the solution for that? In this picture here is a solution also. So you cannot avoid using the phone. You cannot avoid using the computer, right?
Yeah. Yeah.
So what we need to do is you need to hold your phone at least a little bit high level, little bit higher level, and so that your posture will not compromise. If you see in this picture,
Mm-hmm.
she's maintaining the neutral position of her neck, so that at least some extent we can prevent more pressure happening like here. right?
Yeah. Yeah.
And main thing is we need to take a frequent break. We can put an alarm. That's what I tell my daughter also. The break time, get off the chair and go walk around, do something, do some household activities or do some stretches, walking around, like that we can do. Right now we are having snow right now. We cannot walk outside, but I told her to walk inside the home or outside, in the corridor, right? As well as, the timer we can set up, a reminder, because we use for a lot of things for the reminder. So every 1 hour something alarm rings. Okay, I need to do something for myself, do mild stretching like this,
Yeah.
tucking, like that, small things, right? And also avoid looking down for extended period of time, and make sure sit squarely to your work screen. I'm going to share another one screen which is covers up the main things. This is especially
Yeah.
for the people who is working in the computer, especially IT professionals. Nowadays, everybody using. Before, only
Exactly.
IT professionals sitting in front of the computer. Now, everybody, school children to everybody in front of the computer
Absolutely.
all the time, right? So this is a perfect picture I can share with, whenever you are setting up is very important, that we call as an ergonomic modification, right? So very simple. You don't need to do anything high-fi things. You don't need to invest too many things. Whatever the setup you have, main thing is, the setup, the table. Table must be a little bit higher than the chair level, right? And also, whenever you are sitting, you have to sit close to the table. Okay, don't far away. If you far away from the table, you will bend forward when you're touching the keyboard. But if
Yeah.
you sit close to the chair, automatically your posture will be straight. Okay, you can give some back support on your back, right? So that way your spine will be in the straight position. And next thing is, the keyboard. And before that, actually, that's an armrest chair must be there. Your arm has to be rest over the armrest. Okay, otherwise, if you don't use the armrest chair, your hand will be hanging, especially from elbow to the wrist level. Okay, and coming to here in this laptop, if you see here in the keyboard, you have to use the mouse for, sorry, you have to use the mouse for using that. That way you don't need to touch all the time the keyboard, right? As well as, it is in a medical, in the terminology we tell, 15-degree, wrist extension, a little bit of high position like this, not too much of height also. Bending in this way screen is not good. Too much bending also not good at the wrist level, right?
Yeah.
A little bit of height, so that you don't get any pressure over the wrist level. And then the monitoring must be, the eye level must be in the center of the screen. Okay, the laptop center of the screen must be your eye level, so that you don't lean, bend or lean up. So you have to adjust the height accordingly. You need to do that. See here, he increased the height of the laptop, right?
Yeah.
The monitor here. Okay. And next thing is coming down here. You can see the space. Now what happened is many homes they keep all the stuff below their leg. They have no
Yeah,
space.
below the table. Yeah.
So we need to remove all those stuff, make yourself free for that, and the feet has to be resting the floor. Okay, so that your body will not compromise. If your feet is not touching the floor, your whole body system, because all body system is interconnected, head to toe. So that when you change the posture here in the feet, all the posture will be altered. You'll get the pain in the back, pain in the neck, everything will be altered. So I give a given clear idea, right?
Yeah, that was really insightful.
Absolutely.
Yeah. So Anand sir gave a very, what I can say, such an explanation which doesn't need any kind of addition from my side. But still, then two more additions. Anand sir mentioned that you can just prevent the use of keyboards by using the mouses for pressing the keys. I will go one step ahead. That is, use the Google Assistant and just speak and let it type. But to what extent it can understand, but I know that sometimes the Google Assistant doesn't even recognizes our speech and types it correctly, but for most of the searches we can use it.
Yeah.
And one more addition is that especially in resource limited countries, especially in India, in which the students are using their smartphones for their online classes, for their entertainment, for their social media work, everything stuff like that. What I will say is just that you are using your phone just like this. Rather than using like this, you should have a kind of stand or something like that, and just you can attach it with the wall so that you have it at your eye level, rather, because it will prevent two things. First, your hand will not get fatigued by holding it up, and
Yeah.
second thing, you will have it at your eye level. So that's some more addition from my side. But Anand sir, it was a great ergonomic explanation from your end. Yeah, definitely this one. Yeah,
Yeah,
for my
definitely.
daughter actually,
Yeah.
she'll use this. We can set up instead of
Yeah.
holding in your hand all the time. You
Yeah,
can keep the phone here and you can watch
Mhm.
also, something like that. right?
Yeah, absolutely.
Yeah, yeah. There are multiple adding up things like coming up. Some
Yeah.
from the bed itself, from the wall, from something like that. So innovation continues. Yeah.
Mhm.
Yes.
Yeah. Anand sir, you have also done your studies in acupuncture and all. So, can you speak something about acupuncture, which is has been very prevalent in the especially in the Asian region for pain treatment? So, throw some light on the importance of acupuncture and how it can help in pain relief.
Yeah, absolutely. No, because acupuncture play a major role, because that's a traditional method. If you see in Chinese, nowadays, still today they are using that technology long time, even for surgeries and everything, they'll use the needles. Because when I was studied from, Dr. Anand Surya in India, he's the father of acupuncture. He wrote a book called Clinical Acupuncture, you know. I strongly recommend to read it. He covers all the conditions in detail about all the points, all the channels. Simply to tell is acupuncture, why that? Because in our body, there is individual channels for all the organs. For example, the heart, the spleen, liver, the whole throughout the body, the channel is going on, right? When something is happening in our body, some disease, what happen is something blockage happen in particular area. So
Mm-hmm.
what happens is when that's the reason we start getting the pain initially, you know, that then it will go into severe and then it's going to block the vessels in the nerves and also the circulation. And especially when you go to the heart, people getting the heart attack. When you go to the brain, if the circulation is affected, people are getting the stroke. So what acupuncture will does is actually they will find out which channel is affected more. We call it an yin and yang. Okay, so we have to balance both of things. So as acupuncturist, what they do, they will balance the body mechanism. We correct the imbalances to balancing. So they put the channel in a particular way that they are after assessing, they'll put the needles or acupuncture with the needles or acupressure. They'll pressure the point, you know, or we call it some sujok therapy. I studied about that also. Su
Mm-hmm.
means the hand, jok means the feet. So they'll treat all our whole our organs are in the hand itself. So according to the point, they will do it. And some people use auricular therapy, auricular acupuncture, right? So there are different methods. So overall, I can summarize for acupuncture is the best treatment. We can combine. Matter of fact, in our physiotherapy also we do that combination, combination therapy. There we have that, combination of acupuncture or also electrotherapy modalities. Nowadays a lot of equipments are there already available in India, right?
Hmm.
Yes.
Yeah. Dr.
Yes.
Hara, you want to add something on it?
No, it's sufficient about for the basics about for the audiences. Yeah.
Yeah, absolutely. Well, my question now to is Dr. Harprasad, since this is COVID time and we all need our immunities to, be in this. So, how can immunity be improved? Since
Yeah,
we,
before I step in, I will want Anand sir to add upon to it because I guess he's having some slides on immunity as well.
Oh,
okay,
Yeah,
sure.
absolutely, absolutely.
yeah,
Yeah.
Anand.
I will share the screen and then I will explain to you because I got this slide from my wife. As I told you that she's a nutrition
Yeah,
consultant. She's helping a lot of
yeah,
people
definitely.
with
Yeah,
supplementation.
definitely.
Because especially when you're going through right now, see, COVID-19, right? So immune system is play a major role because in our body, whenever your immune system is good, even though the COVID virus go into your body, it will not stay there for a long time. But if it is not good enough, automatically the virus go and stay. It produces a lot of health issues, right? So how to build up our immune system? By taking good nutritional diet. As you're talking about the diet plan, not only for the plan for only for the conditions, every normal human being, we must take some good nutrition. Day-to-day servings of fruits and vegetables, we must add. We have to add. Actually, they are telling, 8 servings of fruits and vegetables. Everybody has to add anyway in any
Hmm.
form. Either you can eat it from the fruits form or vegetable forms or in the supplementation form, whatever you are believing, So
Yeah.
naturally, we are getting a lot of fruits and vegetables in India, so we can have it, no problem. So main thing is what they're talking about. For if you want to build the immune system, you must eat healthy stuff like a vitamin C rich diet. Okay, vitamin A, vitamin E, and iron. Zinc is very very important, and vitamin D, right? So main thing is when our immune system is stopped, that is C is the one is the problem affected. So we need to increase the C, vitamin C rich, like orange, like this type of food. We need to get to back to the dietitian and get information from the health stores and get the knowledge about what are the nutrition will be take care of them. It is called prevention is better than cure, right?
Absolutely.
That way, what happens is when you take regular basis, automatically your health will be not compromised. So that you no need to go to that, take attention for your health issues when it comes, right? Yeah,
Mhm.
you can,
Yeah.
Dr. Hara, you can add up some points.
Yeah. So I will just say some few important things. That is, immunity is not something which is a one-day affair. It even
Yeah.
starts whenever you are not even in this planet. Your parents, your grandparents, your ancestors, your forefathers, their genetics, their environmental exposure, their radiation exposure, everything adds upon to it. So what as a neuroscientist I will say is that there are two circles. One, there is a circle of concern, and next is a circle of influence. The circle of concern are the things about which we all think upon, that is, what if this happens, what if that happens. And circle of influence is something in which we have a control upon, the things we can influence. Just like Anand sir said, that we can control our diet, we can control our nutrition, we can control our sleep, we can control our stress level.
Yeah.
We can't have a control on the kind of pollution level we are surrounded with. We can't have a control on the kind of noise pollution or water pollution, or even the psychological stress from the external factors. So what I will stress upon is that three things. First, vaccination is very, very important, especially in a developing country like India, because immunization, be it active or passive, first of all, the breast milk, because it's a very good source of immunity. Next is the routine immunization for the child itself till the 5 years, and other vaccinations. Next, the diet. There should not be any kind of malnutrition happening, because just like Anand sir mentioned, be it iron or zinc, these are richly available in some of the cheap fruits and vegetables, but the
Yeah.
people are not aware of that. They are just aware that dal roti chawal, the normal Indian diet, but the balanced diet concept is missing, and we need to act upon it. And I will also thank the government of India for starting the Poshan Abhiyan, because it's showing tremendous results, and also the midday scheme in the past some years have shown tremendous results. Adding upon to it, the menstrual hygiene is also important, because due to poor menstrual hygiene, there has been a lot of anemia cases coming up, and when you have lack of hemoglobin, also the immunity gets compromised.
Yeah.
So it's an integrated stuff as well, but nutrition, diet, the child planning of immunization, as well as the breastfeeding, and in a later on, when the child grows up into adult, starts doing job and stuff like that, controlling the psychological stress, because mental strain is something we all are suffering from, and we need to tackle it upon. To summarize, I will request Anand sir to just revisit his slides so that the audiences can just have a relook.
Sure,
Yeah.
absolutely. I'll go back to the screen. As
Yeah,
well,
Anand sir,
yeah.
in 2 minutes only. Yeah,
Yeah.
Yeah,
We'll.
absolutely, absolutely. Yeah,
Yeah.
just I'm going to touch upon, as
yeah,
Dr. Hara nicely mentioned about integrated therapy and everything. We need to really take care of it. And the stress management, he told a couple of times about we need to add up on the meditation also.
Yeah.
That
yeah,
also, that also the best way. Sorry. So just to touch upon back, just a recap, what we discussed so far is about the pain pathways we start with, and then what are the, receptors in our enkephalin and endorphin. So how will the physiotherapy play a major role we discussed, and also how we can take with the gadgets and also the laptop. Main thing is what are the problem we are getting, how do we get the solution, keeping ourselves, and this is the position we need to adapt.
Yeah.
Ergonomic modification play a major role. It's useful for everybody, as well as that good nutrition will play a major role. We need to learn about it, and then we need to go for it. And mainly about the stress management, do a lot of yogas, meditations.
yeah.
We
And I will also suggest that if it going out of the control, then please consult a professional. Don't have a belief that you will go and search on the YouTube some motivational sessions and you'll come out of clinical depression. And also, I want to emphasize two more things. First, don't level depression to a normal sadness. That's a very
Yeah.
common scenario. I don't know international level, because there are quite awareness is happening, but in India somebody is sad and the people surrounding him is start saying that, yeah, you're getting depressed, and next day he post on Instagram that I watched this person's video and I came out of depression. See, clinical depression is something which requires both psychotherapy and in many cases pharmacotherapy. So just have a strong belief. Yes, motivational sessions, they are good upon, but once you feel that you are not capable of coming out, you're succumbing, don't wait for 1 year, 2 year to seek treatment, because your quality of life is going to be hampered. So that's all in
Absolutely.
this episode of this special edition of podcast with Anand sir. So Anand sir, any last message for the audiences
Absolutely.
about pain
Absolutely.
relief, nutrition? Uh, yeah,
Yes, absolutely. Main
summarizing
thing,
in one line. Yeah, one line.
absolutely, absolutely. Main thing is a positive mental attitude. You need to read positive books and connect with the positive minded people, and don't put more negative in your mind. Don't watch too much of news every day. They say always in the news, always they talk about the negatives, right? So put the positive in your mind and live a healthy and wealthy life. Yes.
Yeah,
Thank you so much to
absolutely.
Yeah, yeah.
Thank
Dr.
you
Hara
so
for
It's a
much.
great
opportunity,
message.
and
Mhm.
thank you, Smriti. Yes.
Thank you so
Yeah,
much
yeah,
to both of you.
yeah.
It was
Thank you,
really
sir.
helpful. I hope it is really helpful for the audiences. Thank you so much.
Thank you.
Bye.